From my perspective as an occupational therapist and a developmentalist, I really come from the background and understanding that all behavior serves a function. So when I look at children engaging in stereotypical repetitive behaviors, I want to understand the function of that behavior. Sometimes the function is communicative, and the child's trying to express something to a partner who may or may not be able to read those signals clearly, but sometimes it's clearly regulatory, where the child is upset in an environment, overwhelmed in an environment, maybe under-aroused, they're actually bored in a situation, and they're looking for more stimulation. And in those times, the child goes to something that is comfortable to them. And usually it's whatever sensory strategy or whatever mode of learning is the most salient for them. So children who tend to be visual learners, we'll see them repetitively seek out visual information in their environment, whether it's by flapping their hands or looking at books and edging on lines, or if it's a child who tends to seek out movement, we'll see that's a child who might be up on their toes and running or walking. And so I think it's critical that when we talk about repetitive stereotypical behaviors, that we as the partners really try to figure out why that's happening for a child, because that's going to inform what we can do about it and how we can help that child. Because if we read it as a situation that's just an autistic behavior, we're going to try to stop or extinguish that behavior, which doesn't help the child learn anything. But if we look at it as communicative, we can help replace it with a communicative function for that child, where the child might be trying to protest and giving them a way to protest that people easily understand. Or if we see it as regulatory, we can say, he's really trying to rev himself up right now. Walking on his toes is one way to do it, but I know a better way. I've been on the planet a little bit longer. Let's think about, getting on that hippity hop, going out on the trampoline. Or likewise, if he's upset and not understanding what's happening in the environment, maybe I can give him a visual schedule that will help him. And oftentimes what we see is if we take that kind of detective role and we gear our intervention or our strategy to what we think the function of the behavior is for the child, we see the behavior diminish in the child. That if it is they're flapping because they're anxious because they don't know what's going on, and we give them the schedule, all of a sudden we see that child kind of compose, and you don't see nearly as much of the flapping or the intensity. And likewise, if we've given that child that kind of boost when they're trying to kick themselves up into higher gear, they go, that works, but not as well as this other thing, and we can see them learn new strategies. Oftentimes, the things that we just spoke about that are referred to as the repetitive and restricted patterns of behavior are perceived as challenging behaviors in children. And also other challenging behaviors may be if a child is attempting to protest, they don't understand something in a situation, but their way to convey that is a nonverbal, physical way, whereupon they might push somebody out of their way or flip a table over because they don't understand the task that's been put on in front of them. In those situations, again, it's incumbent on us to really look and figure out where's the function of this behavior and help that child to learn more effective strategies. With that being said, it's kind of a twofold response, because there's the upfront piece where we want to proactively plan for those situations where we think that the child may have a difficult time. So we as partners are going to modify the activities and the environment so there's less chance that the child's going to encounter the situation that creates that challenging behavior. But best laid plans of mice and men, there are going to be challenging behaviors that we see in children, because the world doesn't necessarily always go the way we want it to, and it doesn't go the way that children with autism want it to all the time either. So in those situations, it then becomes the function with the positive behavioral supports is, again, what's the function of the behavior and how do we help that child learn a new strategy or ability? So up front, we want to try to prevent, and on the other side, when we do see it, we want to help that child learn a more effective or a more efficient strategy in a more conventional way to convey their message to us.